right, today we are talking about living donors. That's someone who's alive when they donate an organ. It's usually a kidney. And to learn more, we're bringing in an expert, Dr. Adamson with UofL Health. Dr. Adamson, can you tell us a little bit about what it takes to be a donor? I mean, do you have to be related to someone who needs a transplant?
Sure. So, Shay, thanks for having me. I mean, the donation process involves a workup, and it does not have to be from a family member. So certainly a number of people do donate who are family members, but people come forward to directly donate to spouses or friends, community members that they know. It can really be anybody. When you're looking for a donor, really I encourage every person to find anybody that they may know that may be interested in at least hearing about more of the process. So it really can be anybody.
That's pretty cool that you could not even know the person and help them in this way. Let's talk a little bit about what the donation process looks like. First, the procedure and then also the recovery.
Yeah, so it all starts when the donor, the person who wants to be at least hear themselves out about donating, calls into our living donor coordinator, and they go through kind of a medical history over the phone. If there's someone that kind of meets the criteria to move forward, they get some labs. Ultimately, they get some imaging, meet the physicians, part of that team, and ultimately we have to make a determination as a team if they're appropriate to kind of proceed with donation. So we're trying to rule out things like kidney disease that may not be known quite to that donor. And then the donation will happen. We do our operations on a Tuesday. Usually they're going home either the next day or the day after. They're laid up for a week or so, dealing with kind of pain and fatigue, not to be unexpected after kind of major surgery like this. But usually a month out, they're kind of back to normal, having saved someone's life.
And you can get back to exercising all those things you were doing before.
Yeah, absolutely. I mean, my main restriction as a surgeon is not lifting anything over 10 pounds for 6 weeks. Aside from that, they can kind of begin activities as they feel comfortable.
Wow.
So jogging, walking, exercising, just as long as they're not lifting is okay by me. As soon as they tell me they're ready to do it.
Wow, that is pretty amazing. Okay, so if someone's hearing this, feeling pretty inspired, what's the first thing they should do?
So if they're interested, you can be a good Samaritan donor, which means you just kind of come forward and want to give your kidney to somebody. If you know somebody who is on dialysis and who needs a kidney, certainly ask them where their transplant center is and then reach out to that transplant center and begin that process I kind of outlined. At UofL Health, we do all of our transplants at Jewish Hospital, at the Traeger Transplant Center, so that's really where we do ours, and that's where the phone calls get routed.
That is so cool to think that you could just see this, you can have the idea and save someone's life.
Absolutely. It's a great gift.
Thank you so much for coming on and explaining this. We really appreciate it.
I appreciate it, Shay. Thank you very much.